skin cancer treatment, psoriasis treatment, etc. Um, I think actively participating in research studies with skin cancer is something that I am interested in. So hopefully in 10 years, I will have the papers for that, and also will have the time to fully get that embrace and be part of a bigger thing.
Describe a time when something negative happened to you or you went through something difficult, but the hindsight can be viewed positively, and explain why.
So there's many different things I have gone through regarding this. In my professional field, there's many things I've made mistakes with. Again, I already mentioned it, but I've worked in dermatology for 2 years as a medical assistant. And when you work for someone for many years, you do experience many different things, especially in dermatology. And you wouldn't realize that dermatology is so vast in the things you experience, the type of people you experience. It's not just normal skincare. You get to experience things that are outside the realm of dermatology. One of the most memorable moments for me was a time where I almost caused a lawsuit. We had a patient coming in. I'm not going to specify specifics, of course, for HIPAA, but I've had a patient come in for a procedure. I read the previous note wrong, saying that we needed to repeat this procedure when we didn't actually have to. So I got the procedure all set up. I let the provider know we got that procedure done when it wasn't supposed to be done. Regarding that we realized after the fact that that was not the right thing to do. This is when I kind of was first starting to work there, so I was about like 4 months in working as a medical assistant there. Um, from then on out, that really struck me that I need to start doing things that I got to start thinking before I do things, one, and also make sure you know what you're doing before you do it and use it as a learning curve. If you don't know something, ask somebody. I think it's very important to work as a team, especially if you don't know something. Don't be so afraid to do that. And that's a positive thing. Luckily, nothing happened, no lawsuit or anything like that, and we got everything situated. But I feel like on hindsight, I think I needed to do that and learn my mistake with that in order to fully build up my confidence, in order to talk to other people for help, and also don't fully jump into things if you don't know how to do it.
How would you describe your leadership style?
I would say my leadership style is very democratic. Regarding there's many different types of leadership styles, and of course it does vary. I would say that mine is democratic because I personally like collaborating with other people. Um, I've always wanted to be a leader in the fact where I can work with other people, and I like working with people who are different minded. I'm not gonna lie. I think it's very interesting, especially if you get different perspectives from other people, and especially if you're working in the healthcare field. Like again, as a medical assistant, you work with a team of other medical assistants, and there's gonna be things you're gonna run into. I think it's very important to be able to work together, especially with people who don't have the similar mindsets to reach a common goal. It's not fair to always have one specific mindset in mind and setting that in place. And I think that for the betterment of other people, working together as a team is very important. So I think we should always collaborate and we should always be aware of other people's feelings just so we can reach a common goal.
Describe an example of when you had to adjust that leadership style to address the needs of a group.
So yeah, definitely with that, I would say with the democratic leadership style, again, working together as a team, um, going back to me, having my mistakes in the job I had before, I've had another mistake. Well, not a mistake. I've had an incident at the place I used to work at in dermatology. We had a very aggressive patient where we were all conflicted in what we had to do. It was my patient at the time. Eventually led to the eviction of the patient of the office, but we had to work together, and I had to step up and make the decision of fully talking to this patient, trying to cooperate with them. My other coworkers and the other facilitators of the office, they just wanted to kick him out right away. I wanted to cooperate in the beginning at first. Of course, things led to another. But that was definitely a time that I can see a significant difference in my leadership style than agreeing with everything. But that's what's good. You have to be able to adjust with other people's opinions and sometimes try things if you don't know if it's going to work.
Which do you think is a more important quality for a good health professional? To be an independent thinker or to be a team player?
Definitely a team player. I feel like being an independent thinker and a team player can go hand in hand. I think you should be able, going back to like the leadership style, I think it's important to have your own opinions and voice those opinions. But working as a team is the most important thing. In any healthcare profession, I don't care what it is, you will work in some sort of team. Even if it's a doctor seeing a patient, that after the doctor leaves, the medical assistants come in. They do what they need to do. They do their charting. It's all a process. It's not just one person. I think it's very important to be able to cooperate with each other and get along with each other, especially when working in places before that, there wasn't much cooperation. And even though teamwork was a big emphasis, not having that, not having the emphasis on teamwork is very, it's very degrading to the whole care of patients, the whole process of what needs to be done. And I think that just teamwork is overall invigorating to the whole work life of being in the medical profession.
Thank you.
Thank you. That's a wrap.